In our last video discussing drugs, we looked at how medications can be used not only to relieve the symptoms of various illnesses, but also to cure diseases by addressing their root causes. In this video, however, we're going to explore in detail the entire process that a drug must go through in terms of development, testing, and validation before it can be used in real-world medical scenarios. Since this is quite a long and comprehensive topic, a mini content section has been provided in the description for easy navigation. Fortunately for us, nature has already done a great deal of the hard work. Over millions of years of evolution, both microorganisms and plants have developed an incredible array of chemical compounds that allow them to perform many biological functions, including defending themselves against harmful microbes. As a result, humans have not always needed to develop new drugs entirely from scratch. Instead, we've been able to extract some of these naturally occurring substances, study their properties, and either use them directly as medicines or slightly modify them in laboratories to enhance their effectiveness, safety, or absorption. Let's take a look at 3 famous examples to illustrate this. The first is aspirin, a widely used painkiller and fever reducer, which was originally developed from a chemical compound found in the bark of willow trees. The second example is digitalis, a medication commonly used to treat heart conditions such as heart failure. This was originally extracted from a beautiful, but potentially toxic plant called the foxglove. In fact, the demand for this plant became so high that it nearly went extinct in the wild. The third and perhaps most well-known example is penicillin, the first and one of the most important antibiotics ever discovered. It was accidentally discovered by Alexander Fleming, a British microbiologist who, upon returning from holiday, noticed a mold growing in one of his petri dishes. Interestingly, this mold had killed the nearby colonies of bacteria. Further investigation revealed that the mold, belonging to the Penicillium genus, was producing a substance capable of destroying bacteria. This substance was later named penicillin, and it became the foundation of modern antibiotic treatments. No matter how we find a potential new drug, whether through chance discoveries, natural sources, or deliberate design, every drug must go through rigorous testing before it is deemed safe and effective for human use. There are 3 major factors that scientists focus on when testing a new drug: efficacy, toxicity, and dosage. Efficacy refers to how well the drug achieves the desired effect, such as how effectively it kills bacteria or relieves pain. Toxicity measures how harmful or damaging the drug might be, such as whether it causes injury to our healthy cells or has unwanted side effects. Dosage concerns the amount or concentration of the drug that should be given to produce the best effect with minimal harm. In general, the more of a drug that is administered, the stronger its effect tends to be, but the risk of side effects also increases. The entire drug testing process is divided into several stages. The first stage is called preclinical testing and begins with experiments on human cells and tissues that are cultured in laboratory environments. This phase allows researchers to quickly and cheaply test many different substances to see which ones show potential. However, this method does not provide much information about how the drug would behave inside a complete living organism, as it cannot account for the complex interactions among different organs and systems. If the results from this stage are promising, the substance then moves to the second part of preclinical testing, which involves animal testing. In the United Kingdom, for example, all potential drugs must be tested on at least 2 different types of live mammals, such as mice and rabbits. Because humans are also mammals, the responses observed in these animals give researchers a fairly accurate idea about how the drug might affect humans, especially in terms of efficacy and toxicity. After this, the drug can finally enter the clinical testing phase, which involves human volunteers. Clinical testing starts by administering the drug to healthy individuals. This begins with a very low dose to check for immediate adverse effects and to confirm the drug is generally safe. If no major issues arise, the dosage is gradually increased, while medical professionals monitor the volunteers carefully for any signs of side effects or unexpected reactions. The goal is to determine the maximum dose that can be safely given without causing harm. Once this phase is successful, the drug is then given to people who actually suffer from the disease or condition the drug is designed to treat. Again, the dosage is slowly increased, but this time the goal is to find the optimum dose, that is, the quantity at which the drug provides the greatest benefit while causing the fewest side effects. To ensure that the clinical testing process is fair, unbiased, and scientifically valid, researchers employ a technique known as a blind trial, often combined with a placebo. A placebo is a substance that looks exactly like the real drug, but has no active ingredient. It might be a sugar pill, for instance. During clinical trials, one group of participants is given the real drug, while another group receives the placebo. Importantly, the volunteers are not told which one they are taking, which is why the trial is called blind. In fact, most trials are double-blind, meaning that neither the volunteers nor the doctors administering the treatment know who is receiving the real drug and who is receiving the placebo. This prevents any unintentional bias from affecting the results, as both patients and doctors might behave differently if they knew which treatment was being given. For example, if a person knows they are receiving a new drug, they might be more likely to report side effects, even if the side effects are not caused by the drug. Similarly, doctors might pay more attention to those receiving the actual drug, which could skew the data. Once all phases of drug testing have been completed and the data collected, the results are written up and subjected to a process known as peer review. In peer review, independent scientists review the research to ensure that the testing was conducted properly and the conclusions are based on solid evidence. This final step is essential to the scientific process, as it helps to prevent false claims, incorrect findings, or poorly designed experiments from influencing medical practice. And with that, we finally reach the end of this long but important topic. Apologies for the video being a bit lengthy, but as you can see, drug development and testing is a deeply complex and critical process. If you think these longer videos are helpful, feel free to let us know in the comments, as it really helps us decide how best to format future videos. Otherwise, thanks for watching, and we'll see you next time.